Morning. Welcome to the Managed Care Data Quality Monitoring webinar. It's 10 o'clock. We're going to give folks a little bit more, a few more minutes to come on. This is our quarterly data check, and my name is Amy Peterson. I will be muting myself. I hope everyone mutes themselves for the semi-annual data checks. Colin, sometimes we can't find you real quick, so we can't mute you as fast, but do go ahead and check to make sure that your mics are off, and we will begin shortly. We'll probably start around 10:02, but we have a lot of folks coming on right now. Thank you. Good morning again. Welcome to the Managed Care Data Quality Monitoring webinar. We're going to be discussing the semi-annual data checks, one of our quarterly checks. Please go ahead and mute yourself if you are coming on, because we can't always catch everyone. So go ahead and mute yourself as you come on, and we will continue. Again, my name is Amy Peterson. I'm the Managed Care Data Support Section Chief. I'd like to introduce you to some DHCS staff. My name is Amy. We have somebody who's not muted.
Did Anthony know that you had resigned? Okay, she played it off very well too. I was like, oh,
please mute yourself.
no,
Thank you. We have Deborah Dixon speaking today. We'll have Jeff Jennings and Tyler Brennan. Our support staff, today Atif is not joining us, but we have Samantha Van, Abby Geber-Selassie, May Sean is not in the room, but she's here with us. We have Brianna Saley, who does our projects online. She posts everything, and Sujang Kim, who is really the lead and the brain behind all of this organizing and procedures. Please mute yourselves. Again, it's really hard to keep up with everyone. We get about 250 folks for these bigger meetings, so it can get really difficult. For general questions, please go ahead and submit your question to the WebEx Q&A message box. And please go ahead and ensure that your questions are visible to all participants. Don't send us a private chat. That way we'll capture it and we'll be able to answer it either as it comes in or at the end of the presentation section. For specific questions, go ahead and reach out to the data mailboxes that come up at the end. Every single one of these webinars, we discuss communication and who to contact. So you will get specific information about that. Today's agenda is covering a lot. It's data quality monitoring standards and objectives, data quality and transformed Medicaid statistical information system, or TMSIS, the 274 Medi-Cal data quality monitoring, semi-annual data checks, which is the big portion of this, and the DHCS documentation center. Please go ahead and mute yourself. Thank you. The DHCS Documentation Center is a public site that we'll be going over, where you ask permission to get in, and then we grant it, and you are able to access the documentation that you need. There will be a short commentary on the ECMCS JSON file submission plans, and Tyler Brennan will be leading that charge, and communication related again to who to contact and what next steps are for planning in the future. To go over some of the data quality monitoring objectives, we receive and review the EDI, the electronic data, transaction data from the managed care plans, the counties, and they go right into the post-adjudicated claims and encounters, or PACEs. This particular project, this is part of the monitoring of CART, which I'll go over in a second, but this is all of the EDI transaction data. And you can see on the right-hand side, there's an image that talks about the PACE's data processing flow. This covers all of the 274 and 837 data. So the CART dimensions include completeness, accuracy, reasonability, and timeliness. And what we mean by completeness is we're checking edits. When the data comes in, we're checking for missing or duplicated data. For instance, if that site data should report data in details like a valid city code or a valid county code. We're checking for accuracy. We're looking at typos, finding questionable records, and it's all automated. That, for example, like a site email address that uses funky characters, forbidden characters. Reasonability covers whether or not that data is valid. Examples include the number of distinct organization names reporting in the 274. It must be exactly one, and it must correspond to the managed care plan submitting the file and not any of its subnetworks. So there's little checks like that happen. Timeliness, checks for timely submission of the data. Did it come in at the deadline? And that submission date and time is taken for the most recent submission, and it's accepted before midnight on that submission day. Next slide, please. So those CART dimensions also consider the submission timeliness of that 274 file, in addition to several types of the data quality measures that we just spoke about, related to the reasonability, completeness, and accuracy of that provider file. Each check has an identifier in the format MDC, number, where the 3 X's is representative of a 3-digit number. And that first digit of the number reflects what kind of calculation is determining the score. So that leads me to introduce you to Deborah Dixon, the Data Quality Branch Chief, and she'll be going over information related to TMSIS. Deborah, welcome.
Thank you, Amy.
And Happy New Year.
And Happy New Year, everybody. So I'm assuming you can hear me. Okay, yeah, well, I've been having audio issues, so fingers crossed I'll get through all of this without that. All right, so welcome everybody. My name is Deborah Dixon. I'm the Data Quality Branch Chief here in the Health Information Management Division. For those of you that have been following this for a while, my group has been involved in these for the last few months. So today I wanted to make a tie to the TMSIS reporting requirements, which feeds into data quality that we at DHCS submit to our federal partners, CMS, the Centers for Medicare and Medicaid Services, in order to continue to maintain our enhanced funding from our federal partners. Next slide, please. So we get a scorecard. We in every other state get a scorecard by CMS that tells us how we are doing. There is some information here, some background on what those measures may be, and they were developed by the Centers for Medicare and Medicaid Services. That link there will take you to the website that discusses the details of the scorecard. As you see here, though, there were 3 measures not available in 2023 that will be added to that scorecard in 2024, which is the long-term services and supports for home and community-based services, money follows the person demonstration, and then the users of home and community-based services and long-term services and supports were not available at the time of the 2023 release. So we'll see that beginning in 2024. Next slide, please. All right, so outcomes-based assessment is what TMSIS considers those issues, the data quality issues. They used to be called top priority issues. Some of you may be familiar with those terms. Again, there's a link here that takes you to the TMSIS site that goes through all of the detail of what that means. But at a high level, there are 4 categories that you see here: critical, high, medium, and low, which is the status of those issues that CMS says are data quality issues for us to align and fix with the reporting that we send to them every month. The enhanced funding, as I mentioned before, is at risk if our targets are not met. So tracking of the progress is done on a map. We'll see that on the next few slides. And CMS uses those for assessing and prioritizing our data quality. So it is an issue using a color system on a map that is actually publicly available. Let's look at the next slide. I know this is kind of stretchy. It looks a little weirdish, but this is, sorry about that. This is the best we could get for it. But here's the map that's publicly available for anybody to look at of the United States and where we are. So blue obviously is the color we're trying to get to. That means that they've resolved their issues, their data is good as far as our federal partners are concerned. Yellow means we still have some issues that need to be fixed before we are in the good blue category. And red is what we want to avoid altogether. So we're currently, as you can see, in yellow and working toward the blue. That's the ultimate goal, is fixing all of these issues and getting into blue and staying into blue, which would mean we would have good data quality of all the data files that we submit to CMS. All right, next slide. Okay, so we're going to go over some reminders. We have talked about the monthly data quality checks in October of 2023, and that you can find out on that webinar page where we are storing all of these. There is both the PowerPoint and the recorded webinar at that location. But we've got some reminders that we want to talk about, even though we mentioned this last time. Next slide, please. Okay, the submission rules, as most of you know, unless you're new to this webinar, you use a secure file transfer protocol to submit the files to DHCS. So each plan has got 2 sets of files, the submit and response folders in those files. The plans submit the program data files by putting them in the submit folder, and our PACES encounter system will automatically pick them up for processing. When the file's been processed successfully, the files will be automatically removed from that submit folder. So it's very important not to change the folder structure in any way, because that's going to disrupt the file processing. So our data quality staff that you're familiar with working on issues with, we do not email the response files to the plans. It is done through this SFTP process. Next slide, please. All right, so resubmission of rejected files. If you've gotten a file that's been rejected, it's got to be corrected and submitted as a whole new file. That's really important to keep in mind. We can't correct it at the record level. It needs a whole new file needs to be submitted if it's been rejected. For your submission reconciliation form, each plan is required to submit that by the 15th of the month following submission. So for January, it'd be by February 15th. That document, the plans used to track the 274, the managed care program data, the primary care provider assignment, and encounter data file submissions. Then on our site here at DHCS, we use that information collected by that reconciliation form to validate that all the transmitted files were received, and that's part of the data completeness. As Amy mentioned earlier, that's one of the dimensions is the completeness that we check on this side of the fence, so to speak. Next slide, please. All right, so here's the naming convention and some of the rules around those files. So you see the different color-coded indicators. The X's is the plan name with the spaces represented by dashes. So that's really important. It's one of the things, you'll see that later when we look at data quality issues. Make sure that it is a hyphen and not an underline that's in that plan name. The type specifies whether it's the PCPA or MCPD file. And then there's the format, as you can see, of how the month, day, and year needs to come in the file submission. And the end, at the end of that, is the numeric transaction identifier, which would tell us which number this is coming in, because there could be more than one file submitted on the same day by the same plan. And then the segments of each of those must be separated by an underscore. So a hyphen in the plan name and then an underscore to separate those different segments. The response file naming convention, you see what that looks like, and an example of how that would look in real life, so to speak, once that's been reported in the JSON file format. All right, next slide. Okay, the quality issues. So sometimes there's issues, as we know, as I just mentioned, in whether it's a typo that you see here, maybe letters transposed or the underscore instead of the hyphen, that kind of thing. Our encounter system can't pick up the file unless that file name is following the right protocol. So you see here the correct naming convention and what that should look like, and some examples there. See the MCPD file, what the file name would be, the indicator that's in MCPD, then what the date is, and that would be the second file. So you see the number 2 there. And very important to note the difference between this one and the 274 example below it is the MCPD file would be a JSON file, and the 274 is a .dat file. So keep that in mind when you're working with your folks that submit the files. And also, as always, if the MPI is not on MPES, every MPI field in the 274 and the program and PCPA files requires the MPI to be active and found on MPES. Next slide, please. Okay, so if response files are not posted, we do not send response files to the plan, so we don't email them here from DHCS. The plans need to access those in the folders. You see the names there. The MOVEit and the SFTP system issues that could impact the processing or posting of the files. If you see or have any of those issues, this is the email contact to address that issue, and the analyst can work with you to figure out what the issue is with our encounter system. And keep in mind, it can take up to 2 days for correction and file posting if there is a system-wide issue, if it's something on our side at DHCS. And in that case, the file submission due dates would be adjusted if it's a submission issue that's resulting in file processing that's been delayed for all the plans. Next slide. So site access and denial issues. So two-factor authentication was rolled out in August of last year, and we refer you here to the communication that was sent on August 10th, letting you know that. So plans need to communicate the staff and contact and staff changes, to the email address that you see here, and to the contract manager, so that you know and we know the change in personnel, because they've got to get access to that site. So it could be a matter of, just as you have turnover like we do, make sure that the new folks who are working on those files have got access to the site. And here's the information that would be needed in order to get that: the name, their contact, their title, what folders they're requesting, and the type of folder access. All right, next slide. So there could sometimes be a backlog in the PACES queue in processing files that are sitting out there. So if there's any issues that result in a large queue that backs things up, it would require a few additional days for the system to process those submissions. So the due dates can be adjusted, as we mentioned before, if it's an issue on this side. So you would want to email, there's the two boxes, whether you're talking 274, it would be the provider data mailbox. Encounter data would be that encounter data mailbox that you see there, to inquire about delays. If you're taking a look and you haven't seen anything and it looks like that you're coming up on delays or maybe late submissions, make sure you contact us through those two email boxes. All right, next one. Data quality monitoring and semi-annual data checks. Let's take a look at that. Okay, so as most of you know, if plans anyway that have been working with us for a while, every month the Data Quality Reporting Unit does perform the data quality checks on the 274 files that the plans submit. There are 17 of those. Each plan gets a monthly data check report that summarizes what the results of those files were. That is emailed to you. So the plan, in order to get a passing score, each of those HCPs within their plan has to pass those 17 data quality checks. And then plans are encouraged to refer to reference material to get to see the pass file thresholds. And that's something we'll talk about a little bit later, in which we did last year as well, in terms of where to find that document, information on the documentation center. All right, so the semi-annual data check is a tool that's used to identify whether the plans have corrected those deficiencies, if there were any, in the monthly data check. Season 2 reports were sent out January 16th, so very recent, representing the data quality checks for the July 2023 data, which was submitted in August, through December 2023, submitted in January 2024. The metrics and thresholds are identical to the 17 metrics. The SGC uses the most recent submission for any particular month's data to make sure that the deficiencies have been corrected. So those of you, we've walked through this process, like I said in the beginning, at the last, when we talked about this last October. So if there's any questions about the information that comes out the report in particular, we talked about the submission of the report to the plans through email. If you need those details, so we talked about that in the last webinar in October. All right, next one, resubmission guidelines. So plans are expected to correct all the issues and resubmit the 274 data file. So the report can capture the file resubmissions up to 12 months after the initial reporting period. So you see an example there of a plan resubmitted a corrected file for January 2023, reporting period in July. So the resubmission would be captured in the season 1, the January to June report. So the plans need to respond to all of the failed metrics, and unless they've got an exemption, if there has not been an exemption granted, they have to correct and submit before the next data quality check time frame. So those that's a part of the report that is emailed to folks every month, telling you what those issues are. You need to correct those before that next season takes place. All right, next slide. So here's a report example of the resubmission check. You see the plan there, the date and the month, the original file, the most recent file, and whether it was a resubmission or not. So you can see it's bolded if it was and what the differences are. The second one there, it was resubmitted in November, originally in September, et cetera, et cetera. So I'll let you read that for yourself, but this is just an example of what that looks like. Next slide. The reference examples. So here are the reference checks, how they are described. So you have the organization name. In this particular case, the pass threshold. Since we're talking about organization, there should only be one plan parent. And each one of these has got a description of what that check, that data quality check is for all 17 and what those pass thresholds are. All right, next slide. Here's a report example of the threshold checks. So you can see same thing, the dates, whether it was an original or an updated, if they passed or did not pass. Same thing, the idea is to just show a report example of what that would look like and how to read it. And next slide. So some quality issues. Again, we've talked about these in the past, in the last few slides as well. Often it's just a misspelled email address, some character that shouldn't be in it, an underline instead of a hyphen, just those kinds of things that I'm sure you run into on a regular basis with normal emails that we would do. So it needs to follow the distinct format or our system cannot accept it. Sometimes there's a mismatch between the county and the county code that's reported. And then again, Amy, I think mentioned this earlier, the unverifiable site. It used to be OSHPD. You might know it by that identifier. It's HCI now. So make sure that those site IDs are good and verifiable, and there's not any issues with those. Next slide. So here is a reporting summary. So this is season 2. July through December of 2023. And the numbers, as you can see, look pretty good. We're excited to see anything that's in the passing category for our plans. And then we would take a look at if there's lower numbers, such as the physician extender affiliation you see there, or the site telehealth indicators. Those kinds of things help us work with the plans to find the root cause of what's happening and to fix those so that next submission, we get some accurate data. So it's looking pretty good there, as you can see. And here's an example of a semi-annual report. Again, there's the data quality code, check what it is, the name of that, the percentage. This one is comparing the January to June with the July through December. And you can see there's there's two that don't match. There's the site provider member counts and then the site telehealth indicators. So again, this would be information that would go to the plans, and we would work with the plans to find out what those issues are and to resubmit those so that they can pass those thresholds in the next submission. All right, at this point, I will turn it over to Jeff to talk to you about the Documentation Center.
Morning, everyone. This should be fairly brief. It's informational, and it does currently apply primarily to the managed care plans. As I've been mentioning in the chat, you know, traditionally behavioral health, medical managed care have kind of operated in two separate worlds. The push is on the national and state level to start to integrate much of that data. So the reason I'm mentioning that is that while most of the documentation that is currently posted to the Documentation Center is in regards to managed care plans and the files that they submit, at some point, behavioral health related documentation will be shared on this Doc Center as well. I am familiar with the DHCS and other sites that currently host companion guides and other documentation that's related to county mental health plan operations, short Doyle, et cetera. So those will remain where they are for the moment, but eventually the Documentation Center will be comprehensive in terms of the documents that are posted there. And I will say that for most county plans, there are already some documents of interest that are available on the Documentation Center. What we've done due to some of the constraints that we run into with the posting to the DHCS internet site is to create an MS Teams site that works for about 98% of us. And for those that it doesn't work, we have alternatives. But this seems to be a good place for us to store documents, data dictionaries, other files and artifacts that have to do, schemas that have to do with submitting files and working with them. If you do want access, the best way to obtain that access is to send an email request to dataexchange@dhcs.ca.gov. That's listed elsewhere. and we'll get you started right away. If you run into any technical issues accessing the center, it's the same idea. Contact the data exchange mailbox and we'll get that sorted out to you. Again, if you can't access a document, we'll email it to you, but we will get it to you. That's a lot of the documentation center right there. Kind of a short blurb. Just want to let you know. And you're welcome to follow up with other questions to the data exchange mailbox related to documentation, et cetera. We're always happy to help.
Thank you very much, Jeff. We are getting some questions in the chat.
Yeah.
And you're welcome to either respond via chat or we can read them at the end of the webinar during question and answers. But I'll go ahead and present this next slide for future ECMCS JSON file submission plans. Not a lot to highlight, but I'll go ahead and do it. And then folks can go ahead and email us questions directly or put them in the chat for subject matter experts to go ahead and answer as they come up. So next.
And Amy, if I may, I just want to acknowledge one thing. We've been going through quite an extensive reorg here at DHCS. We are trying to update our mailboxes and other points of contact, labeling, etc. So bear with us. We'll get that sorted as quickly as possible. I do see some questions in the chat related to that, which I'll answer directly, but just want to let you know that yes, change. It's the nature of the game. So we'll do our best to get you the most accurate information we can as quickly as possible. So thank you, Amy.
Thanks, Jeff. Thank you very much for presenting for you and Debbie. Tyler Brennan has also answered a couple questions. The documentation center does have the schema, and I'm going to go ahead and move forward. I'll try to ignore the chats as I speak, but the future timeline for dynamic data collection and reporting related to expanding the use of the JSON files. Like every quarter, we are moving closer and closer to having more and more data coming in on JSON, and the quarterly implementation monitoring report, or we call it the QIMR, the data elements in that build the enhanced care management and community support JSON files. So we're getting them simultaneously right now. We're getting the QIMR and we're getting test files. I believe they're test files, might be in production now. And we will use the new straightforward onboarding to process, which is, Eugene has discussed this pretty much in every webinar, but a lot of that information is coming on. And then again, you get edits and information responded to let you know whether or not that data has passed through PACES. And to our real subject matter expert, Tyler Brennan. Welcome, Tyler. Tyler is a HPS2, a health program specialist too with the Managed Care Quality Monitoring Division. And he is going to speak directly about the ECMCS guides and JSON transition plan.
Thank you so much, Amy. Really appreciate it. And as I've already been introduced, my name is Tyler Brennan. Happy to be here to talk briefly about the ECMCS and CCM JSON transition for ECM and community supports. So we can go to the next slide, please. So really, this is just reflecting the policy guides for the boilerplate and state regulations and the APL. This is just referencing where these requirements come from, but managed care plans essentially must meet all program and reporting requirements as DHCS specifies, etc. We have the ECM and community supports companion and technical guides also posted to the DHCS documentation center. If you haven't seen those already, we encourage you to go take a look if that's relevant to you and your work. But those are all available there. So please just feel free to email us if you have any troubles downloading that. Next slide, please. Okay, so we are doing this transition in phases, and the QIMR, which is the Quarterly Implementation Monitoring Report, is not being phased out for quite some time. So that process will live on in its own for a little while now. But while we continue to report normally through the Quarterly Implementation Monitoring Report, we will also be transitioning to JSON for a hopeful future switch. So right now, essentially, most of the elements that will be included on the JSON reporting mirror that can be found in the quarterly implementation monitoring report, with the exception of a few fields. And relevant to the first phase, one of those fields is the CCM SIN. So we are requesting, and this is sort of a new request, but we are requesting the SINs of anybody who's receiving either enhanced care management or complex care management. And that's so that we can do some analysis on our back end. So phase one is starting with January 2024. The first file, this is going to be a monthly file submission. The files are due on the 10th of every month, and the month following the reported month. So for January, the files will be due by February 10th, for February, March 10th, etc. Coming July 2024, we will be expanding the file to include most of the ECM elements that currently are already captured on the QIMR, but it will essentially just bring it up to parity on that front. And then in January of 2025, we'll be phasing in the community supports information. Next slide, please. So this is really just a visualization. Oh, sorry, we can go back forward one. Yeah, so yeah, this is just a visualization showing kind of what that phase transition looks like. Right now we're in January, moving into February, so we'll be getting the ECM and complex care management SINs. Phase 2 in July will include all the ECM information, and phase 3, all of the community supports information. So we're doing this really to gradually step up and make sure that all of the managed care plans are, gain comfort and being able to submit these files accurately and on time. Next slide, please. All right, and yeah, just to reiterate, first file submission will be by February 10th. We do and are accepting all questions. If they're more programmatic in nature, we encourage you to send them to the CalAIM ECM ILOS mailbox. However, if they're technical, for more technical assistance, such as questions about the companion guide or questions about planned parent names or file structure, etc., please just make sure that you're including the data exchange mailbox on those requests. If not, we'll make sure they get over there anyways, but it would just help us out a little bit and more quickly responding to your requests.
I echo that. Thank you, Tyler.
Of course. So yeah, all managed care plans are expected to submit these files monthly. First submission date, as we've reviewed, is February 10th, covering January. The files will include all available data from the previous month. So we are expecting to see all of the utilization and provider information included in these files for the previous month. And as I said at the very beginning, the QIMR process will live on. Those reports will still be due within 45 days of the end of each quarter. So the next QIMR, which covers the Q4 2023 period, is due by February 14th. And I believe that rounds me out. So I'll stick around and answer any questions in the chat, but thank you very much.
Very much, Tyler. And thank you, Jeff, for popping on and letting people know what to expect in the data documentation and what's available in the center. I wanted to cover communication. As we know, it is hard sometimes to make sure that you're getting to the right people and to the right email boxes. Next slide, please. When we post these webinars online, we post them as a slideshow. We provide the recording, but all of these underlined, underscored text are actual live links, and you'll be able to hit them and be able to email people directly from the PDF that's posted. So the data group mailboxes for this webinar include the data documentation center access request. When you request, we get immediate notification. We provide access. It's a public site. At the same time, we do want to know who's using it. Webinar is us here at Managed Care Data Support. So that is the mcdss at dhcs.ca.gov email. And the 274 MCPD, PCPA, and 837 have a Managed Care Quality Monitoring Division email box. ECMCS JSON file is a little confusing, but it is the CalAIM ECM ILOS at dhcs.ca.gov. ILOS was changed to CS, and so that email box is older than the CS designation. But those emails will come to those folks, and if you click it, that's where it will go. The data exchange, again, documentation center access requests, as well as questions about data exchange and anything urgent, you're going to want to mark urgent in your subject, and we'll get it to the right people, regardless of really where you send it, but you want to make sure you try to get it to the right people the first time. Next slide, please. So all plans have assigned analysts here at DHCS. That person is a primary contact, and there's a backup contact. If you're unsure about who your current analyst is, you can reach out to this provider box for clarification. And that again is managed by the Managed Care Quality Monitoring Division. So it's MCQMD provider data at dhcs.ca.gov. Again, it's going to be a live link in the webinar post. Next slide, please. So managed care plans, you're limited to 4 contacts. So your 4 plan contacts are going to be your primary technical contact, your primary compliance contact, and you really don't want to include any contacts that you don't want to share information like a corrective action plan or an error message or anything like that. You're going to assign a liaison to DHCS from the managed care plan, and that liaison will distribute information accordingly and appropriately as needed internally. Next slide. Every time a plan has inquiry of any type, please go ahead and do the following. You send the inquiry to your plan's assigned analyst. You CC your plan's backup analyst. Those are folks here at DHCS. And you CC that provider data group mailbox at MCQMD provider data. Again, if that message is urgent, please go ahead and mark it as urgent in your subject line. Next slide. So I know there's probably a lot of questions, and these webinars are posted online every month. When we hold them and host them, we put them up online so that people can access them for training purposes and refreshers and reviews. A lot of it is iterative, but here's the next steps for what we have planned and topics that are coming up. So the data collection status is pretty much everything is in production, and we're testing phases with counties for DMC ODS. But you can always know that you can ask these questions about what's in production to your analysts. Next slide, please. We have a lot of resources, and I did discuss the webinar page itself, but our webinar series is posted online. It is on the DHCS website, and this is what it looks like. There is an opening page on the data quality measures and reporting section of the website, and then it follows up with the webinar series in the next click, and that will take you through all of the posted information from 2023 starting in April and moving into 2024. Again, we're always continuously improving the website and the resources that are on it. Next slide. So the webinar series webpage looks like this. Again, I explained that it covers the 2023 schedule and the 2024 schedule. And we have a lot of information on there for folks. So the webinar series webpage for training, recording the scripts, and the PowerPoint slide decks with all of those live links. And we also include the upcoming webinar schedule. Additionally, we have frequently asked questions, so information that you're posting in this chat that gets answered. If it's relatable to everyone, we are posting it in their frequently asked questions. If you have separate questions, you can always send them directly to folks at MCDSS, and we will add information that is appropriate for the frequently asked questions. And that way you get a really detailed informational product that you can use for as a resource and refer to. The glossary itself, we are really working hard to make sure that there's common terminology, common terms used across the board, and so that there's basically definitions for acronyms and for information that we are discussing in these webinars. And what we mean is what is in the glossary itself. So the terms that we use frequently in each one of these webinars is going to be included in the glossary. So the upcoming webinar schedule. We just covered the January 2024 semi-annual data checks. In February, we're going to be going over behavioral health short Doyle. March coming up is going to be qualitative data templates. And then we'll start the new year, so our anniversary, which is the April 2024 annual address. We started this series in April of 2023. In May, we're going to cover the 274 managed Medi-Cal, 274 Medi-Cal managed care provider data. And in June, we're going to cover the 274 for the mental health plans. Next slide, please. July is again another semi-annual data check. It's a big one. And in August, the encounter data is going to be covered. September is going to be the 274 for dental. In October, we go over the monthly data checks. November is 274 DMC ODS. And December is the MCPD, PCPA files, and expansion. So there's a lot of provider information within this webinar series. So if you have any questions, this is a good time to either put them in the chat or it's hard to do online with voices, but we can call on you if you have a specific question. You can put it in the chat and then we can ask you to verbalize that. But so one of the things I can do right now is just kind of go up into the chat and see what hasn't been answered yet. Again, we are posting this deck on the webpage. That will probably be in a couple of weeks. Does this webinar pertain to behavioral health and or DMC ODS? Yes, this webinar series does have a section on DMC ODS, and you'll be able to find that on the webinar series page when that comes up. Hopefully you were able to hear me.
Yeah, and Amy, most of the questions in the chat have been addressed, I think, to some degree.
Wonderful.
I've got
I'm
a few
just kind of
follow-ups to
flipping
do.
through to see.
Yeah.
Okay.
Yeah, thank you for
Looks like
handling
you
that.
covered the doulas too. I'm sorry, Deborah, go ahead.
Sorry, Amy, you're talking all over everybody. Sorry about
I know.
that. No, thank you, Jeff, for answering a lot of those questions so that folks know some of these are may need a little more research or too complicated to put in this particular area. So we'll be responding, as we've mentioned on this call. We keep tabs on questions and we do respond to them, and then we create FAQs as well, so there's always a reference to them, so nothing will go unanswered. But to Jeff's point, and I've seen other folks have mentioned in here, in the past this was strictly just medical and managed care plans. That's what we started with, but the intent, as we have reorged here and we're integrating data from the other areas, be it dental or behavioral health or whatever the case may be, we will be expanding to standardize what we're doing. So obviously we'll give prior notice to that, but just keep in mind that this forum, the intent here is to capture all of the different data and have the standardized checks and such that span all the different types of data, not just Medi-Cal managed care plans.
Exactly. Another request for a link to the webinar posting. And I'll answer Megan Gilmore's question. More than 4 people per plan can access the documentation center. We don't really have much limit on that. So that's fine.
We do include a link to the documentation center in that
Yeah.
webinar series page.
Right. And then there is the link for Destiny to the webinar series page itself.
Yes.
So
There was a question from Oleg, and you said you wanted to answer it at the end of this webinar. I don't know if you
I think we
meant
might have to follow up
live.
internally since it's kind of an
Okay.
internal question. So I think probably it'll be Deb and myself that speak with Oleg about that. So
ACEs. Again, if there are any other questions. Will I be receiving a response via email? Can you
well, let's find that question.
Can you go ahead and put your question back down here so we can see it really quick? Otherwise, I have to scroll up through a lot. Okay. For the 274 data quality check, site and provider member counts, we see few PCPs flagged. And can you take this into account for these type of providers and not flag them as low member counts? That is beyond my pay grade.
Yeah, I think that also might require a little bit more detailed follow-up.
I would agree with you, Jeff. Yeah, I think we have to internally respond to that. So I would say it would either be an email response or a call if necessary, but I would imagine an email response. But yeah, we do have to take that back internally.
And Shanti, can you identify the organization you're with?
Yes, hi, my name is Sushanti. I'm from Community Health Group.
Oh, okay, no problem. Yeah, well, I think we're going to have to go chew on this one a little bit. It's a good question, a bit detailed. Let's see what we can find out here internally, and then we will follow up with you.
Okay, sounds good. Do you want me to send an email?
You know, why don't you go ahead and send an email to the data exchange mailbox, dataexchange@dhcs.ca.gov.
Okay.
And data exchange is kind of all one word. So
Okay, thank you.
yeah, and we'll get back to you ASAP. Thank you. Got it.
A new question related to the need to submit the JSON file, and will DHCS send detailed documents about it so that they can share with IT?
When that starts to extend into the behavioral health area, we will give you plenty of preparation, communications and preparations. I don't know if there's a timeline for that yet, but we will follow up with further information as that determination is more firmed up, probably the best way to put it. I would say yes at some point, but there's no timeline immediately. So.
Thank you. Okay, I'm not seeing any more questions. We have a few more minutes if you have a last minute question. Otherwise, we will capture whatever can be shared in the frequently asked questions page, or we will make sure that a subject matter expert gets to you as soon as possible. Can we get the exact email address where we
from Dale? Hey, Dale. I will send basically email dataexchange@dhcs.ca.gov, and we'll add access for you immediately and contact you and let you know.
I'm sorry, say that one more time.
Pardon? I'm sorry.
Say that
Go
one
ahead,
more time. DHCS.
One more time. I'm sorry. I just didn't hear you.
No,
I'll put it
address one more time.
I'll put it in the chat.
Oh, okay, very good. Thank you.
Yeah, that way, it's not me mumbling. There we go. Somebody did put it in the chat.
Fantastic.
So there we go. That covers it both. Thank you, folks. Yeah. And that also addresses the email address for ECMCS files. CalAIM mouthful of letters, email address is a good one. And data exchange can also be copied on those questions as well. We work together with Tyler and the team at that mailbox. So either one of those work. Yes, good. Thank you. Kim, or I'm Sue Jung, sorry. A little.
Unmuting myself.
Yeah.
Again, any other questions related to this webinar or the series, or any questions that you have if you miss something, mcdss@dhcs.ca.gov, and I put it in the chat. All of these informational emails are available on our contacts page and on our webinar series, and every webinar has the contacts for that specific webinar. But again, if you hit either data exchange or MCDSS, we will, and you have your urgent question, we will get it where it needs to go. It'll help you liaise. Thank you so much for all of these great questions. Again, we will be collecting them and making sure that your questions get answered, and that people are able to get updated on webinars, upcoming series. One of the things we are working on is a way to go ahead and subscribe online to the webinar series so that you know you're subscribed, and getting information from our listserv when we do update. So we are always making improvements in the quality of these webinars themselves, and we appreciate your comments and suggestions. You can send those to mcdss at dhcs.ca.gov, and we will try to incorporate those as we can. I will now go ahead and adjourn this meeting. Thank you very much for participating and your high levels of engagement in the questions. We really appreciate it. Thank you so much, everyone.
Thanks all.
Bye now.